Hi, everyone. Welcome back to Command Q, the podcast for quitters. Today, we're talking about something that's a hot topic for a lot of self-employed folks, healthcare. As the freelance workforce grows, there are more and more of us out there trying to navigate the insurance marketplace and get the care we need in a system that's just frankly terrifying and expensive. Today's guest fought her own 5-year battle to get diagnosis and treatment for her chronic illness, and it inspired her to become a certified patient advocate who has built a career on helping other people survive a convoluted healthcare system. Please welcome author and founder of Little Engine Patient Advocacy, Kristina Kelly.
So this warm-up question comes from Jenna, and Jenna says she has an oddly specific fear of having a minor accident in public and a stranger calling an ambulance for her when she doesn't want one. What should you do if something like that ever happens? Got any ideas? Because you got the medical bills, you're doing the whole and you're like, oh,
I didn't want the ambulance.
I wasn't expecting any of this, and I just have a concussion. It's fine. I can walk it off.
Yeah, I mean, as long as you have the ability to speak, I think it's always appropriate to use your voice to say no, and maybe have a backup plan. Like, please do not call 911, but here's my phone. I will allow you to call my partner or my sister or someone to come get me. I actually had this happen with my husband. I had a collapse in the middle of the night and I was on the floor. I couldn't move my legs. I couldn't form words. I had slurred speech. And all I could get out was this drunken, and he finally woke up and came and he's like, should I call 911? And I had already had so many bad medical experiences to that point that I had no interest in going to the ER. I felt pretty confident in my body that I would recover like I've had in the past and I would get through it. So I was able to shake my head and be like, no, but that's not medical advice, by the way. If you do find yourself paralyzed on the floor, please call 911.
Yes. I was going to say, I think I would have ignored you and went ahead and called.
Yeah.
We were seasoned with the muscle weakness thing at that point. So it depends on your experience.
Mm-hmm.
Yeah. So that actually brings us to the first question, which is, what is your experience in the healthcare system that sort of drove you to think about what you're doing now?
That broke me. Yes. No.
Yeah.
No, broke me. It reshaped me, I should say.
A freelancer.
Yeah. I have a bit of a patchwork, career history or a portfolio career, as some may say. So I have a freelance career in digital marketing where I've had the pleasure of working with Uncompany. And prior to that, I had healthcare experience. So I worked in neurology offices on the admin side. I also was a healthcare service coordinator for the Muscular Dystrophy Association for years, working clinics right here at Duke and UNC. What wonderful organization and great experience I had working with the MDA. But when I decided to really focus my career in digital marketing, because I really loved to write, I loved the creativity that came along with marketing. And I was about 2 years, I want to say, into building that business, left, corporate America agency life behind to start my own thing. And that's when I got sick a couple years into it. I had a gnarly virus in March of 2019. We're not sure what it was. I was put on antibiotics, and 1 month later, I describe it as a drunk, phantom prankster morphed into my body. All of a sudden, everything just started going haywire with pins and needles and patchy numbness and burning in my hands and feet and horrible fatigue. And that would sort of kick start this really long, really difficult healthcare journey where I was now on the other side of the exam table and experiencing healthcare as a chronically ill patient. And that kickstarted me going back to school once I got answers and once I started feeling better. Went back to school to become a board certified patient advocate and started a patient advocacy business and wrote my patient advocacy book. And now here I am.
Cool. So what is a patient advocate?
What an excellent question. One of the things that I have discovered in becoming a patient advocate is that no one knows what it is, which can make marketing a bit of a challenge, but good thing I have some background there. So a patient advocate is someone who works either with a hospital system or a clinic or directly for a patient. So it's considered to have two types. You either work for a hospital system or you work directly for the patient. I am an independent patient advocate that works directly with the patients, which means the only person who signs my paycheck is the patient. Unlike patient advocates who work in the hospital systems, yes, they're meant to help resolve patient issues and handle complaints. And at the end of the day, it is the hospital who is signing their paycheck. So an independent patient advocate is going to have a focus area. Perhaps it is medical coding and billing. So if a patient gets a huge hospital bill after a major surgery or cancer, or they're just so overwhelmed by their bills, they can call a patient advocate who specializes in medical billing to help reduce debt and help them figure out how they're going to pay off that bill. And then there are other patient advocates like me who focus more in diagnosis and treatment navigation, specifically with autoimmune and connective tissue diseases. So they each have their niche. They could be dental and other areas as well.
Tell us a little bit about your niche, how you got there. We know that you were diagnosed with an illness. And if you wouldn't mind sharing a little bit about that, and then how you got into sort of the patient side of the patient care as opposed to like the billing side. Because when I first read about it, I thought immediately about the billing side.
Yes.
I didn't think about the diagnosis side.
Mm-hmm. Yes. The diagnosis side, especially for autoimmune conditions, can be extremely difficult to diagnose for a few reasons. One, there's just, science isn't complete. Science is always evolving. So a lot of the times autoimmune conditions are diagnosed based on antibodies. Well, the antibodies aren't discovered. An example of what delayed my diagnosis of Sjogren's disease, I didn't have the traditional antibodies and had to be diagnosed in other ways. Technology too, as wonderful as technology is, I think there has been this shift over the decades where physicians stopped looking at the patient and the clinical history. And a lot of the focus is now on, you had this test. I see this report. I'm looking at this number. The number says normal. So nothing can be wrong with you. And that is where my journey started. And this whole idea of quitting being the passenger in your healthcare journey and being the driver, that is where it all stems from. Because when I first got sick, and I went to my primary care and I told her, hey, I'm having these pins and needles and this burning and this horrible fatigue. My hands and my feet are such a mess and what's going on? And she showed concern. She referred me to a neurologist. I get to the neurologist and she says, you know what? I'm really concerned. I really think you have MS. There were like eyes full of sympathy and a hand on the shoulder. And here's an order for an MRI. Please don't sit on it. Early intervention is key. And at this point, and I think a lot of people can relate to this is what we expect from healthcare. Like, you are the passenger. I showed up with an illness, not feeling well. Doctor took the driver's seat, it's controlling where we're going here. And unfortunately, that is doesn't always give us the outcome that we want. And it's not that all providers are bad or they don't want to help you. I think the healthcare system is set up in a way that fails both medical providers and patients. So when I got that MRI and returned, they make you wait, 3-4 weeks before you can get an appointment to get your results. Sitting in the exam room, all anxious, wringing my hands. And this neurologist who had shown great concern at 3 weeks before, walks in on a breeze with a smile on her face and said, I just had to hand this to you in person. And she hands me a completely normal MRI report. Like it was the best news ever. Like, congratulations. We found nothing.
Right.
Nothing is wrong with you. And I was so taken aback by the excitement. And because I also had, somewhat of a background in healthcare, I also have family members who have MS. I knew not one brain MRI confidently ruled out MS either. So I was really baffled in that moment. And I think that's perfectly illustrates, like, you can either say, okay, you're driving this. I'm still the passenger. Okay, I don't have MS. I'm just going to go home and go on and hope that my symptoms go away. Maybe I'm just sleeping wrong. Maybe I'm just getting older. I mean, these were thoughts that went through my head, but, I just couldn't accept that that a normal test result meant that my symptoms didn't exist. And that would sort of be the theme for the next 4 or 5 years. It took me over 4 years to finally get diagnosed with 2 autoimmune conditions.
Wow.
Yeah. I mean, I feel like especially the way that illnesses are happening, because I've had this conversation about autoimmune conditions and, who we come across, especially with independent workers, so many of them have undiagnosed illnesses, chronic illness, autoimmune conditions that don't allow them to work a traditional job. And so they're looking for alternative ways to work. And for me too, going through the process of diagnosing what I had took the same process that when doctor sends you here and it's like, whatever you do, don't eat apples. And then you go to this doctor, whatever you do, only eat apples. You're just kind of bouncing between all these different diagnoses and different opportunities to try something different and do another scan. And the hard thing about it too, and I think this is where I think advocacy is so critical, is that it's so isolating and it's scary. You don't know what the diagnosis could be, and you're not moving forward. You're just kind of treading water, but you're not feeling good. And so having somebody on your side who can help you navigate that and just honestly, even mentally organize what you're looking at. And then what's the next thing you need to do? Because it's like those kind of processes are full-time jobs for people. It's like, I have to schedule appointments. I have to wait on a referral. I have to go to the appointment. I have to sit there and wait on that feedback to pay for the bill. And I have to take that information to get to this other specialist. It is a full-time job. And people who also have full-time jobs, it's no wonder that they get lost in that system and that process, because it's so tiring. It's emotionally tiring. And it's just so cumbersome, So I think there's been such a need for patient advocacy for so long. So I'm glad to see that starting to become more of a role that's in the world.
Yeah, I 100% agree. I think that there's a lot of reasons why people sort of stay in that passenger mode and have a hard time, quitting that position and moving to more of a staying in the driver's seat, because it is so exhausting. I mean, it is a full-time job, and you're really sick and you're really scared on top of it. And, I talk to patients all the time, and I can admit that I felt like this, and I talk to other patients who say the same. I also very much viewed medical providers as authoritarian type figures, that I'm supposed to respect them and they have all the education and they're supposed to take care of me. So don't contradict them. And that was really hard to get over, that. Like, if I spoke up for myself, like in that neurology appointment, I did on the spot say, well, as one, I would pose it as like such a passive statement, because I didn't want to contradict her, but I felt like I needed to speak up for myself and say, well, would one brain MRI rule out MS? Don't I need like a thoracic or cervical MRI or a spinal tap? And I will never forget it. She laughed. She laughed and said, you do not need a spinal tap. And it was just, you took an action and you feel like you get reprimanded for it. So then it makes it harder to stick up for yourself in the future when you have these like gaslighting moments, to be able to hold on to your confidence and to feel empowered in those moments. And that is something that I concentrate on a lot as a patient advocate. And in my book was, how do you hold on to your confidence? How do you regain it? How do you reduce appointment anxiety? Because I think that is something that is very real, that anyone battling chronic health issues deals with.
Yeah. Did it make you doubt what you were feeling with your symptoms? Because I would imagine it would make you feel a little crazy to walk in. I feel this way, I feel terrible, all these different things. And the doctor's like, you're totally fine. There's nothing wrong with you. And, and you're sitting there going, am I nuts?
Oh,
Is this just in?
So many times. I mean, especially when those type moments start adding up. You go to the next doctor to get another opinion and they say, no, the other doctor said you're fine, you're fine. And then you go to the next person because you're getting sicker and sicker. And that next person says, oh, I think they missed tests. I'm going to run some new tests. And you think, yes, this is my moment. They're going to find it out. And then the labs come back normal again. And it happened so many times over 4 years that I absolutely thought, well, I'm the common denominator. I've seen all these different providers and they're all telling me that everything is fine. So it must be me. I must have some sort of psychosomatic condition or something. So I saw a therapist. Who had experience with chronic illness. And it was one of the best moves that I made in my healthcare journey, because she got to know me and she was like, you absolutely do not have a psychosomatic disorder. You don't even have anxiety. She goes, I think you have anxiety induced, like you have anxiety induced by your medical experiences. But what I'm going to do is I'm going to write you a letter saying how long I've seen you, how often we meet, and that you do not have a psychosomatic disorder. And so I keep it in a medical binder along with other key records. And this is another thing I help patients do to prep it for each appointment. But anytime a provider says to me, oh, are you sure it's just not anxiety? Are you sure it's just not stress? You need to go to therapy. I whip out that letter and place it and I go, great. What's next on your differential? Because we can cross that one off the list.
Wow. So what do you think causes this sort of like desire for the doctor to just get you in and out of the office? Is this part of a broken system?
100%. Like I said before, I do think that the system is set up to fail providers and patients alike. They're set up to see so many patients in one day. And not only the face-to-face time that they have, but battling insurance companies behind the scenes and keeping up with portal messages and medical records. And I think that it's become such a profit-driven business and not a patient, care-driven business that it sets these providers up to fail. Now, don't get me wrong. I mean, I think there are some just downright bad doctors. I don't feel bad saying that.
There's a lot of bad people in a lot of professions.
Exactly. Right? Exactly. Not just healthcare.
Right.
Once I learned to trust myself and that it wasn't me, I wasn't crazy, I got really good at breaking up with doctors, ghosting them, leaving them, quitting them, and moving on and finding new opinions outside my current hospital system. I even traveled to multiple states to get answers and opinions, which worked really, really well for me. I think it's just a matter of trying to find the providers who have learned to work in a broken system. There are, functional and concierge and integrative and private practices. And there are some different avenues, that we can take to try to find providers who have learned to overcome the system a little bit.
Yeah, I'd love for you to talk a little bit more about how you prepare to go into those conversations, because it's, John and I've been doing this podcast for a while, and one of the things we see is the connected line of like people pay attention. That's a big theme on a lot of our podcasts. And I think that one thing that's interesting with just going into the doctors, the idea that it is, you kind of come in, you're like, fix me. You're not walking in prepared. You're not walking in the driver's seat. You're really walking in with the expectation of immediate trust that they're going to do what's best for you and that they're going to know the whole you. And that's just not possible for a doctor to know the whole you. So I think the way that you're talking about it is really powerful, because the difference is like, you need to help them know the whole you, and you need to take ownership over those pieces that allow you to get the right answers, as opposed to expecting them to fill in the blanks. I would love you to talk more about how you prepare for those appointments and the materials and those pieces that you bring to the table, maybe the research you do before you go into an appointment. Because I do think that that's super valuable, because you're kind of like, before you even go to the appointment, you're already prepared for it, which I think is very different than how a lot of people approach, going into medical diagnosis.
Yeah, you are absolutely right. How I showed up to my first appointment, like that first year or so appointments compared to how I show up now, night and day difference. I would show up almost like going to the spa, like, I don't feel good. I booked some services. Can you take care of me? And I'll walk out and feel better and ignorance is bliss. But now I have a completely different game tactic. I mean, I show up, I treat it like a job interview. I truly, every single appointment, unless it's with what I consider a unicorn provider, which is like a provider that I 100% trust. I always know that they're looking out for me. If it's not a unicorn provider, I treat it every appointment like a job interview. And I do at least a week or two of prep before I go into that appointment. And that prep includes creating a goal setting statement for the appointment. So I think a lot of times we go into these medical appointments, I know I did early on, and just say, the doctor always walks in and they're like, what are you here for? How can I help you? And you would normally say well, man, I've been having, this horrible hip pain, and my primary care sent me to physical therapy, but I've been in physical therapy and it's just not getting better. And then I don't know. I mean, I had this injury from some time ago, and I mean, I was such a rambler. I think I would probably like go way too into the rabbit hole in the provider's eyes and start rolling in the back of their head if we would like lose them from the beginning. So now I create a goal setting statement that has very, very clear intention that you set at the beginning of the appointment. So when they walk in and say, well, how can I help you? What are you here for today? I've been experiencing hip pain for 7 months. I've been in physical therapy for the past 4 months. My pain has increased 19% according to my health tracker app, and I am here to get an MRI to see what's going on. I don't wait until they offer the thing that I hope that they're going to give me. I set the intention of what I want in the appointment. Now, how do you do that? Like some people will be like, well, how am I supposed to know if I need an MRI? And, Mara, you mentioned research, and research is a huge part of that goal setting appointment too. So looking at, what causes types of hip pain, or what have I been told in the past? Okay, bursitis. Okay, would bursitis last that long? Would bursitis get better with physical therapy? Oh, it wouldn't get worse. Okay, what would make bursitis worse? And this is really where I focus on a patient advocate, is doing sort of that detective work and that rabbit holing for you to do those lists of possibilities so that you can bring that research to the appointment. I always consider it like evidence in front of a jury. Like, okay, here's all the evidence that we have. Here's research supporting this diagnosis. Can you help me understand how this may align with my story? I think sometimes people hear like, oh, I'm supposed to show up with research and tell them what I have. Like, you don't do the doctor's job for them. You're going to like really, make them mad. And it's a dance. I knew I had Sjogren's disease before I could get a rheumatologist on board with me. And the way that I finally got a lip biopsy ordered, which is the gold standard test that if you're seronegative, you do not have the antibodies, is to get this lip biopsy. Well, I had gathered a bunch of research from the Sjogren's Foundation and the Sjogren's Advocate and all the Johns Hopkins and Mayo and all these really trustworthy sites. And I brought the research. This was the 4th rheumatologist over 4 years it took. And I just said, listen, I know I have had my antibodies tested, but I am telling you, I keep getting sicker. All my symptoms align with Sjogren's. And I came across this research. I would love to discuss it with you. Talks about a lip biopsy, and 40% of Sjogren's patients, don't have the antibodies, and this lip biopsy helps them get a diagnosis. Would you be willing to talk to me about this? And then it tries to create a more collaborative relationship.
The conversation. Yeah. It's one thing you said too that I think is really critical, is that you can choose your doctors. That sounds like a silly thing, but I think a lot of people just assume that, oh, this is the doctor that's next door to my house, or somebody referred me to, or I've gone to forever. I'm going to stick with this good doctor. And, you said multiple times, I'm kind of going into this for an interview. And I remember when my mother was sick and we were going through the process of her diagnosis and going to her neurologist and discussing like high levels of, at this point, it was like fish oil for dementia and heavy metals and all these different, and they had no idea that this thing was a potential treatment. And I knew right then we should find a different doctor. But the idea that you can, even if it's a personality clash, there's doctors out there that are just not a good fit for you as a patient. And it's okay to talk to them. If you bring information, you bring research and they push it away, it's a good sign that's not a doctor that you want to work with, and that's your choice.
Absolutely. And I think some of the pushback that I get from patients when we talk, and I even felt this myself, was, oh, I'm so nervous to get that second or third or even fourth opinion in my case, because I don't want to look like a doctor hopper. Whenever I have a provider,
I've never heard that phrase.
I've had doctors accuse me of being a doctor hopper. So, they'll say, oh, well, I see here you've seen a lot of providers, and the providers here said that nothing is wrong. I have these comebacks in my back pocket that I have memorized and prepared. I list them in my book. I help patients come up with their own tailored to their situation. But if we have these confident comebacks, I call them, ready to go, I'm so anxious in appointments. I'm already going into appointments feeling like I'm going to be gaslit. I'm going to be dismissed, which then already causes anxiety. So having some pre-planned statements. So any provider would say anything along the lines of, oh, you're here for another opinion, or, you look like a doctor hopper. I could say, well, I've been chronically ill for 5 years, I'm always faced with the choice. Do I stay with a doctor who's telling me nothing is wrong while I'm getting sicker and sicker? Or do I seek another opinion in fear of looking like a doctor hopper, but I'm trying to improve the quality of my life and figure out what's going on in my body. And I'm going to choose the latter every time. And I'm unapologetic for it.
It's your body and it's your life. It's like, you might as well spend the time finding the right answers.
Exactly. And building a healthcare team that you trust is not easy. It's easy to sit here and say, oh yeah, you should say this in appointments and you should get those referrals and you should get that next appointment. There's tons of battling that goes into every referral, and wait times are, 6 months. My longest wait time was 14 months for a specialist. So it is wild out there. So while I say that it's really easy and, just quit being the passenger of your healthcare journey and be the driver, I totally recognize that it is really difficult. And I would remind anybody who feels overwhelmed by hearing that small steps. I am not about leaps and bounds. I'm about like waddles and shuffle steps and small flexes. If you can just practice one goal setting statement in your next appointment, then you can add on the medical binder, then you can add on the research, and then you can add on planned questions and agreed upon next steps. I do not leave an appointment anymore with saying, okay, so we talked about this, this, and this. Next steps are this. And if that lab comes back normal, what step are we doing after that? Or if that test comes back abnormal, what's the step after that? And have it agreed upon before I even walk out the door.
Oh, that's really good. Never thought about that before.
It's like getting the next commitment to a game of cards. Like you're saying, we're going to play one more round, right? Like you're not just walking away from the table.
Yeah, sure. I mean, it's the same thing you do in a business meeting, right? You lay out your next steps and then you say, this is the decision that we made. These are the next steps. And then when we come back to the table next time, this is what we anticipate having in our hands. But it really is it sounds like a lot of this is treating your healthcare just like you would treat your work life, your business life. I think so many people are afraid because there's a lot of unknowns. To become a doctor takes a lot of education and experience and practice. And by the time somebody gets through those 12 years or however long it takes, we have a lot of respect as a society, I think, for that effort and for that knowledge and all the work that's put into that. And it's very difficult to imagine that this person might be wrong when they have, 12, 15 years of education, 10 more years of experience. They've diagnosed all these different people. They've done these studies over here. They've got this paper and they've got, a fancy plaque on the wall. And you're sitting there going like, no, you're wrong. You're wrong. That's not the way I feel. That takes a lot of courage, but it also takes a pretty strong conviction because I know nothing about my own body. Like in reality, I know what I should eat on a daily basis and what I shouldn't eat, I guess is what I know. I really don't know anything about how the human body works, except for what, my biology class in high school. Right. Like, other than that, I'm relying on experts to tell me what's going on. And, so that's where someone like you, I guess, steps in, right? I get in this situation where I'm going to go back to your hip bursitis thing, because that's a relatively, I think, simple example of this. I'm going to physical therapy. The physical therapist says, hey, there's something wrong here that is more than what we can fix. A lot of times that's how you end up in these places too, right? The PT says, there's not a lot I can do for you here. You need to go get an MRI. And then you walk in the door, you maybe don't get the answers you're looking for. And then, I would start to search around and try to solve it myself because that's my nature. But it sounds like I could cut out a lot of pain and struggle if I reached out to someone like you as a patient advocate and at least had a conversation and said, what do I do next? So how do you take people in? How do they come to you? And what's that process look like?
So people usually find me through word of mouth or on my website, and you can schedule a consultation call with me. So I do free consultation calls because as a board certified patient advocate, I'm committed to not taking on patients that are not appropriate. So like if somebody came to me and said, oh, I have extensive dental health issues and I can't afford dental treatment, my specialty isn't in dental. So what I would do is get as much information from them as possible and then go out into my network and try to find someone who is a better fit for them and align them. But if they are a good fit, which is typically they suspect autoimmune or connective tissue like Ehlers-Danlos, and then all the fun sidekicks that go with those conditions like dysautonomia and small fiber neuropathy, I can usually tell right away when they start telling me their symptoms. And a lot of the times too, like I think we have to get better at trusting our gut too. I think because of so many bad healthcare experiences or medical gaslighting, that inner voice, that gut feeling starts to get quieter and quieter and quieter. But when the patients are talking to me and they're telling me their symptoms, they're almost describing to a T the condition that they think that they have. And I'll say, so, it sounds like you might have POTS, or it sounds like you might have lupus. Have you heard of that before? And they're like, oh, yes, I totally agree. Yes.
You want confirmation?
Yeah, I think we really crave that confirmation and that validation because we've been told that nothing's wrong with us, for so long. And not to dismiss the folks that were diagnosed out of the blue. I always feel like their patients fall into two categories. Nobody can tell them what's wrong. Nobody's willing to treat them or get the right treatment, and they're getting sicker. Or they get acutely sick, they get slapped overnight with a new diagnosis, and they have no idea what it is, how to deal with it, what are the possible treatment plans. So those are the other type of patients that would come to me saying, I don't know what this means. I just got diagnosed with multiple sclerosis. Is my life over? I don't even know what questions to ask. I don't even know where to begin because there's such instant overwhelm in that situation. So it's sort of like, both could benefit from a patient advocate just in different ways.
Mm. So you mentioned your network a little bit, and that spawned two questions for me. Question one is, when you take these people in, obviously another challenge in this is paying for healthcare services. And one way to reduce paying is to get to the right people as quickly as possible, right? I can eliminate a lot of costs if I see fewer doctors and I get to the right doctor as soon as possible. I'm starting to think out loud a little bit, but is there a way? How do we find those right doctors? Do you have a database of people in your specialty that you go like, these are people that I've worked with in the past or that my other patients have had success with, and they're really good at listening and they are these sort of unicorn doctors? Have you assembled that or have a network like that? Or is there a network that exists of people like you who kind of you can call and get referrals and be like, yeah, this guy over here has really helped some of, 3 of the patients that I know or whatever?
Yeah, a few things pop to mind. So I don't necessarily have like a Rolodex of just aged myself, Rolodex.
Right.
It's fine.
I know what you mean. I remember.
There's so many, dozens and dozens of different type of autoimmune conditions, neuromuscular conditions, which is another one of my diagnoses. It would be pretty hard to have an ample list for all those different conditions, but I do sort of have a template process that I walk patients through. I can either, and speaking, because you brought up cost, a lot of the times, working is hard, medical bills are expensive, and money's really tight. So, someone may not be able to say, okay, I need you for 8 hours to help me find a new specialist, prep me for the appointment, follow up with me after the appointment. Maybe they can't afford that hourly rate, for 8 hours. But what I can do is help them with self-guided activities. So they may say, well, I suspect I have myasthenia gravis, but I'm in a small town. Like, I don't even feel like my neurologist even knows what myasthenia gravis is. Like, who should I see? And then I can have a process of where I look through myasthenia gravis support groups, a lot of like Facebook support groups. If you go to files, they have kept a record of all of the providers that are the patients have, recommended. Those patients, that's been really helpful to me. Going on forums like a Facebook group, Smart Patients, Inspire, there are all these different groups out there. You could say, hey, I'm in North Carolina. I think I have myasthenia gravis. Does anybody have a neurologist who specializes in MG that you could recommend? And then get recommendations that way. I take all those little tidbits from groups and from posts that I may create, and then I compile them. And then I go on to health grades or other review sites for medical professionals. And I'm not only just looking at stars, like, oh, okay, if they got 4 out of 5 stars, I'm considering them a pass. I want to look through all of their written reviews. And I want to say, is anyone in here mentioning myasthenia gravis? Like, this provider helped me diagnose myasthenia gravis, or they helped treated my myasthenia gravis. That's what I'm looking for. And I'll sort of put together a top 3 or top 5, depending on how many I find, and I'll rank them in order and say, okay, here's what I would do. Call your insurance company, call the clinic. Do they accept your insurance? Are they in network? Are they out of network? Because again, talking about quit being the passenger, be the driver. Don't just show up to an appointment hoping that insurance just pans out, because you may be seeing a doctor that's out of network and you're going to get hit with a surprise big medical bill.
Yeah.
Yeah.
Absolutely.
Well, speaking of insurance and or non-insurance, obviously we work a lot with freelancers, and that always tends to be one of the biggest reasons why people are afraid to step into unemployment is that looming, I'm not supported with insurance. What am I going to do? And so, it's always a big topic of conversation between us at the office is like, how do we help freelancers? How do we equip them with information that they can, either self-insure or, what are the ways that people navigate insurance when they are self-employed? So you've both been a freelancer and now you're doing this. So you're kind of the perfect person to ask this question. So we'd love your thoughts on what are ways that people who are self-employed can navigate their own healthcare and still be advocating and making smart decisions when they might not be in the position to have employer insurance.
Yeah. Yes, I can definitely speak to this. I feel like when I first started my business doing 100% freelance, I had marketplace insurance. I basically closed my eyes and went like that and just got one that seemed like the cheapest because I was healthy and who cares? I'm sure I'll never need it. Knowing your insurance plan options, whether it is through an employer or you're shopping in the marketplace, I think it's really important to understand the differences between a PPO plan and an HMO plan, and what is your copay and what is co-insurance. And I dive into this a bit in my book to what are these terms, knowing these terms, which one is going to be right for you, because knowing your insurance plan intimately can save you so much money. I'll give you this example because it tickled me pink. I was sitting in a waiting room for an ophthalmologist in an ophthalmologist's office. And this gentleman walks in and he goes to the counter, he goes to check in, says his name. And she said, okay, that'll be $50 copay. And he said, no, actually, my insurance gives me 1 preventative appointment for free per year. She said, oh, and she looked and she goes, oh, you're right. You don't owe me any money. You can sit down. Easily that could have been $50. And if you think, it really starts to add up. And there are these also other incidences like upcoding, not necessarily done maliciously, but for example, if you have a surgery scheduled, you have a surgery of anesthesia, pays for the surgeon, and it usually pays for a follow-up appointment. And that exact same day where I'm sitting in this waiting room, a woman walks in after that guy, and the receptionist, very warm, very nice, and, oh, Mrs. Miller, she had a patch on, how are you feeling? How have you been since your surgery? She said, oh, I'm doing great. And the receptionist said, well, this is a follow-up. It's already been part of your bill for your surgery, so you're good. You don't owe any money. But easily that could have been a situation of upcoding where they would have said, oh, this is a follow-up appointment not tied to your surgery. That's a $25 copay. So it's saving yourself money, not just picking the right plan for the start, which is also very important, but then staying on top of your plan and knowing what you are responsible for and what you're not responsible for. And then treat it like you're shopping and you're trying to get the best deals. I was supposed to get an MRI at one of the major hospitals, here in town. And I called my insurance company. I made sure, hey, this is what the code is, the diagnostic code is for it. Are you going to cover it? They said, yes. I said, okay, how much will I'm going to owe? And they said $800. And I said, that's ridiculous. $800. I'm going to have insurance. What? Why am I paying $800? So they said, well, you can try to find it cheaper. I said, well, I will. So I called around. I said, tell me what my network is. And I called around all these places and I got one for $400. So I saved myself a half off sale, and I got my MRI for 50% off.
Well, and it's a lot of patience on your side too, because I do think, it can be really frustrating when you feel like when someone's trying to pull one over on you. And you're right. Sometimes it's just a mistake. I mean, it's like sometimes those people at the office just ran things twice or didn't pay attention. I was telling about when I had both kids and we self-paid our insurance, and I was very diligently paying attention to every single bill that came in, what was paid. And I caught a couple times where they had billed me twice for the same thing. And I pick up the phone and call and be like, hey, I've already paid this. I have the receipt. I have it. I've seen that it's gone through. And they were just like, oh yeah, that's okay. Don't worry about it. And I was like, this is like a couple $100 for whatever it was. And that happened at least twice. I do think there's a level of information, paying attention and knowledge that is really important, that you have to pay attention to those details.
Yeah. Especially when you're sick and tired, sometimes you don't have, like we say in the chronic illness community, we say spoons. Like you don't have the spoons for that. It's based on the spoon theory where you have, let's say 12 spoons a day, and taking a shower takes 3 spoons, and changing your bed with fitted sheets takes like 6 spoons, and you want to make sure that you're using the appropriate amount of spoons per day so that you don't trigger your symptoms, you don't get a flare, you don't burn out. But doing all this, making those calls, fighting for those referrals, staying on hold for 15 minutes to talk to somebody in your insurance company, that all takes spoons, and it's exhausting. So while we do need to be our own best advocate, I would tell people to keep two things in mind. Take breaks when you need to. Tackle just one thing at a time. Try not to get overwhelmed by all the things on your to-do list. And if it is too overwhelming and you have no spoons left, that's where somebody like a patient advocate would come in and say, let me call around and try to find an MRI that's cheaper for you, for example.
Mm-hmm. Yeah, that sounds like money well spent. I'd rather you call around than me. Just personally. But also, one of the things that frustrates me a great deal about the healthcare industry, and full disclosure, I worked for the largest pharmaceutical distributor in the country early on in my career. And one of the things that I noticed being on the inside from the IT and finance side, because it was a little bit of both, but also I would be in the pharmacies all the time with the pharmacists doing all the work. There are so many layers and levels of complication in our healthcare system. Whether it's on the diagnosis side, you have multiple layers of complication. And then on the billing side, you have probably even more layers of complication. To get a 200 milligram pill of Tylenol to a person and then get it billed takes, 100 steps. It's kind of insane. All of the different steps from ordering the drug, having it come in, someone counting it, putting it in the robot, putting it in the packaging machine packs it. All the different things that go in that, it moves it to the floor, then the person gets it, they take it, then somebody, bills it out, says that they took it, time, date, place, right dosage, all of that. It then goes off to who knows where in the billing world and hits a bunch of different people as they all take their pieces. There's just so many steps in the process, right? And then by the time you get that bill, you come home, like honestly, half the time you don't know what happened to you if you were inpatient in a hospital. You don't know necessarily what drugs were given to you if you were knocked out and had surgery. They might tell you after the fact, but it's really hard to remember and keep track of that. And so one of the things that I learned to do based on that experience, if you're in the hospital, have someone else sit with you and write down everything they do. Like every medication they give you, every time a nurse comes in and checks on you, what the nurse says. Anytime a doctor shows up in a room, find out the doctor's name, what they're there to do, because you might have 6 doctors come in, right? They're all going to bill you. Every single one of them is going to bill you, even though you don't know who they are and why they're there.
For 5 seconds of their time.
For 5 seconds of their time. And, so and it's on the patient advocacy side, but on the billing side, but it's also kind of on the care side. You need to know who those people are. And as the patient, it's really difficult to keep track of that because you're in there and you're sick and you're not feeling good. When my wife had our son, that was the role that I played. I sat and just was like, this is this doctor, this is this nurse, this is the time. That helps, I think. It's really hard, but to have a family member there to help you and support you emotionally, and then have another one there to help protect you on sort of this other side. What do you think of that as a process?
I love it. And I agree. Whether it's in a hospital setting or even you're anticipating a tough appointment, bringing somebody with you to advocate for you or to document for you can be so helpful. The only advice that I give on that is just make sure that you're assigning somebody a role who has the capability of fulfilling that role. Sometimes we may bring people to an appointment and say, hey, I'm going to have to fight really hard to get this thoracic MRI because I don't feel that MS has been thoroughly ruled out. So back me up. Well, that person may be just as anxiety ridden in that situation or as shy as you are, and it's not helpful. So we want to make sure that we assign, roles correctly. I would also say that it's equally important to get your itemized bill from a doctor's office or a hospital and then compare it to your EOB or explanation of benefits from your insurance and sort of do a line match. A lot of the times you'll see a misalignment, and it's just a matter of calling the provider's office and saying, hey, this wasn't coded correctly, or it looks like there's an error. They could see it, fix it, and then resend a new claim out or bill out.
A lot of people don't know that those codes are done by hand. There's usually people.
So much room for error, right? I mean, yeah.
I think that's a good tip because usually once we finally complete the appointment, we're like, and you just assume it's all going to be, it's going to be fine. No one's going to bill me $300 for aspirin. I think that it's really, it does take time to do it. There's a way to organize yourself so that, I started just keeping a spreadsheet where it was like, here's the appointment, here's what happened, here's what I paid, here's when it was paid, here's when it was cleared. And then I would just track it that way. So it was really like a before, during, and then after process. And I think you can simplify it as much as you can. But I do think at some point, when you get into those diagnoses that are years long, or that can be really hard. Like my mom had dementia, so it was multiple years, multiple doctors, in a full emotional process. It is so key. I have a patient advocate for my brother who helps me navigate the process with special needs waivers and housing and all of that stuff. And it's a valuable thing to be able to use. I think it's awesome what you're doing.
Oh, well, thank you so much. And you said something that stuck out to me, the after part. I feel like the after gets forgot about a lot. So I'm so happy you said that. We prep for the appointments, or we try to be as diligent we can if we're in the hospital. But the after part is something that I learned to take control over too. And that was reading your visit summaries. I could not believe how much inaccurate information could be in those visit summaries that was quite damning. So that when the next provider read it, it was continuing a false narrative that was working against my efforts. I am a huge advocate about keeping very clean and accurate medical records. Have your patient portals, read your visit summaries. And if it's okay, if they got your weight off by 5 pounds, that kind of stinks, but let it go. But if they say that you had this test and it was normal and it wasn't, or that they did this exam and they did not, I had a record in one of my visit summaries, 12 really significant falsehoods in my visit summary. And, I messaged the provider and I said, these medical records will follow me for my life. Please make the following 12 changes. And I attached a Word document that listed the error and why I felt it needed to be changed. And all 12 were changed. And it is enough. It's like one more thing, but it could really give you headache and hassle in the future.
Mm-hmm.
Yeah. You end up feeling like you're doing other people's work when you do that.
Yeah. But why am I not getting paid a doctor's salary?
Well, and get copies. I mean, that's one thing. I just got an MRI done 3 weeks ago and haven't gotten copies of. My doctor was like, you're fine. And I was like, I want my $1,000 picture of my head, please.
Good for you.
Give me those.
Yes.
I pay for it. I want my picture of my head.
Yeah.
So I have an appointment with them tomorrow, and it will be like, please give me my pictures of my head, because I keep that in my file. So every 5 years I have something to look back at. But
absolutely,
you have to you really have to pay attention to it, because it's your information too. It's like, that is your history. You deserve to have rights over that and have copies of all of it.
Yeah. And again, I don't necessarily think that providers are trying to do something malicious, but things fall through the cracks. A CT scan of my chest done as part of my myasthenia gravis workup, and the neurologist said, oh, your CT scan was totally normal, so no worries. What do? I immediately go to the patient portal. I look at the report, and it has a diagnosis in there of emphysema, and I'm not even a smoker. It was like a huge red flag, which turns out Sjogren's can cause a lot of lung issues and ended up getting a referral and then officially being diagnosed with COPD. Had I not looked at that report, I didn't have an explanation for my shortness of breath at that point. So it was kind of, that would have gone a stone unturned for who knows how much longer had I not looked at the report myself.
Mm-hmm.
Yeah, that one would make me pretty mad. I'm going to be honest.
Yeah.
You're spending a lot of money and a lot of time and energy and effort, and somebody says everything's fine, and then you find out that it's not in that way, and it shows up on the test. I mean, all he has to do, or she has to do, whoever, is to read it.
Yes.
I mean, you just go to the very bottom where it says impressions. You don't even have to read the whole thing. Just go to the bottom.
Yeah, and it's a lot of money and time, but that speaks to the inefficiency in this system and in this process. The reason why that's missed is not because the doctor is illiterate or incompetent most of the time. It is because they are so busy and so rushed from one patient to the next, or they document it after the fact. Maybe a bit of time has gone by and they've seen 4 patients, and then they go back and do the paperwork on all of them. And then things get muddled and messy in your memory. And so that's why I think so many people are so frustrated with healthcare is that you go, you see, you hear, you do whatever, you think you're doing the right thing. But if you don't understand what's going on behind the scenes, the machinery behind the scenes, then you would absolutely miss that. I would have totally not gone and read that report and had no idea. And then been back in a doctor's office going, I have a shortness of breath and I can't get rid of it.
It's all part of that advocacy we're talking about, right? Just always advocating for yourself, looking at your records, maintaining your records, keeping track of your test results and your insurance is all really important to the process because you just never know what's going to fall through the cracks. And, it's exactly why I named my book, How to Be a Badass in a Broken Healthcare System, because that's exactly what it is. It's just very broken.
Yeah. What do you think when you hear people say America has the best healthcare in the world? I'm just curious.
This is an added question.
I just get a whole range of emotions.
Well, that's part of why I did it. But the reason why is because when I hear people say that, what I hear is, you've never had a major issue. You've never tried to navigate this system. I think you'll learn one day.
It's one of those things that you truly have to walk in those steps before you understand, all the nuances, and that makes the system so complicated. Do I think that there are amazing things about our healthcare system? Absolutely. Do I think that there are amazing providers and technology that is just above and beyond that we have in our healthcare system? Absolutely. And it is just it's such a profit-driven business. And I think a lot of that causes a lot of the issues. I mean, I have friends who live in UK and, they don't pay for their insurance and they move over there and they're like, this is amazing. Like, I just showed up to a doctor's appointment. I said, what's my copay? They looked at me like I was crazy and and that sounds all wonderful. And then one of those friends did have some health issues. And while she still didn't have a copay, she did struggle to find the right specialist or feel that she was seen or heard. So that may be a bit of a universal, issue.
Sure. With the trade-off that there was no copay.
Right.
If we're going to get basically the same 14-month wait to see the doctor, then,
I would like to not hand over a $90 copay.
Yeah. I would like to have that rolled into my taxes or something else. But yeah, so all of this, I could talk about this forever and ask you a ton of questions, but we've been talking for an hour now. So we're going to move into our lightning round. These are 3 quick questions. Hopefully they're a little easier, quicker. First question, and this is about costs. So you may or may not be the right person for this, but we came up with these beforehand. Right now, the cheapest bronze plans on the marketplace have a 50% co-insurance after a high deductible. A lot of times they can be $7,000, $8,000, $9,000 deductibles. Can bad insurance actually be worse than no insurance?
Oh, that's such a great question. It was like a lightning round, like fast answer. That could be a very long answer. We can never predict the future, right? When I had marketplace insurance, I was healthy, and not having insurance and just doing self-pay probably would have been a lucrative choice, but I wouldn't have known that I was going to get sick, and I could not have imagined doing the journey that I had just done without having even bad insurance. Now, that being said, I will give this little tidbit. If you are paying self-pay, and let's say you're in the hospital or you're at an MRI and you get this massive bill because you have no insurance, always pick up the phone and call the billing department and negotiate. The worst you hear is a no. You can say, listen, I have a $2,000 bill. I have saved up $1,000. If I give you $1,000 today, will you write off the rest? Like, it happens, or can I have a payment plan? Or, it doesn't hurt to just try to negotiate and try to ask. And also, you'd be surprised that labs can be sometimes cheaper when you don't go in through insurance. So I have a doctor that doesn't take insurance. She wanted out of the broken system. She's doing her own thing. But when I need labs through her, I said, well, how in the world am I going to be able to afford blood work, through you if you don't go through insurance? She goes, doing it outside of insurance is so much cheaper. And I almost didn't believe her, but it's hiked up so much when you go through insurance. Getting the exact same labs I've gotten a million other places through my insurance was dollars. I mean, I'm talking like $7, for basic labs because it didn't have to go through insurance. So sometimes, it could work, but I think you have to weigh the cost versus benefit and like the risk analysis associated with that.
Yeah, interesting. All right, next one. What's the dumbest charge you've ever seen on a hospital bill?
Wow, I wish I had a really, really great story for that. Because I don't work in the insurance side and the billing side that much. And I don't think I've had a really dumb one.
Well, how about on the diagnosis side? It sounds like your missed MRI was pretty...
I certainly have had really dumb diagnoses. I've been misdiagnosed twice. I fought for a rheumatologist after I saw another neurologist, made sure MS was thoroughly ruled out. And that neurologist had ran some basic autoimmune tests. So I had a positive ANA, which indicates that there may be some autoimmune things going on. And anti-centromere antibodies was this antibody associated most commonly with scleroderma, but I didn't really have any symptoms of scleroderma. But it was enough to get me a referral and get me into a rheumatologist. That rheumatologist walked into the exam room, didn't ask me a single question, didn't learn a thing about me, didn't lay a finger on me. And she said, you have chronic fatigue syndrome. You just need to accept your diagnosis and move on with your life. And I said, well, what's the diagnostic criteria? Chronic fatigue syndrome. And it's like, she's like, I don't have that. I don't have that. Like what? And then she said, fine. Call it fibromyalgia then, if that makes you feel better. What's the diagnostic criteria for fibromyalgia? I assume it's joint pain. And at that time, I didn't have joint pain. That would come later. But at the time, I didn't have any joint pain. So that was dumb. That doctor was dumb. And I don't feel bad saying.
Wow.
Yeah, that sounds a little dismissive.
I was diagnosed with chronic fatigue when I was a senior in high school. I slept my entire senior year of high school. There's jokes with my friends about how little I attended school. Because I was sleeping 18 to 20 hours a day for about 6 months. We couldn't really figure out what it was. They called it chronic fatigue. I believe that it was environmental and it wasn't actually an illness. I lived in the city on the Ohio River. The Ohio River is pretty polluted. We just moved there. There's a lot of things going on. And I think I was having some sort of reaction, whether it was an allergic reaction or a reaction to whatever was happening. Because as soon as I left and moved and went to college, I was totally fine.
Oh, wow. Yeah. I mean, mold toxicity or environmental, like all those things could,
Who knows? Who knows what it was? And to this day, when I go home to see my parents, I get sick every time. So,
allergic to Ohio.
Yeah. But it's one of those things where, we struggled just to get a diagnosis for me. And this was in the early 90s where who knows, they were just throwing spaghetti at the wall and trying to get something,
looking at the tea leaves, really imagine.
I still don't know what it was. And, one of the things about chronic fatigue is that it tends to come back in adulthood, in midlife, and I've not experienced any symptoms. So there's no way that that's what it was. A similar type of story. The doctor just is like, this is what you have. And you go, oh, okay. All right. Yeah. I'm sleeping. It makes sense.
Sounds good. Sure. I will say on my hospital bill, when I've had my first child, I remember seeing the charge for Tylenol and it was something like $4.75 a pill or something like that. And I didn't really need it. You just said like, do you want some? And I was like, sure. And so when I went back and had my son Charlie, I was like, we're up to this. Okay, Amanda, would you like some Tylenol? No, absolutely not. Don't come near me with that bottle. I brought my own.
Very smart.
Yeah, $4.75 is actually cheap for Tylenol in hospitals.
No, it's 400.
Oh, 475. Oh, yeah, that I was going to say
two,
that's
like whatever.
more like,
Yeah,
I've seen
but
300,
3 or
I've seen
400.
275. Yeah,
It was in the hundreds, and I was like, "That's." And I remember asking my sister-in-law, who said she's a doctor, and she was like, "Yep."
It's
like,
criminal.
She's like, you can bring your own. I was like, I will bring my own.
Yeah, that just feels criminal.
Right.
Absolutely.
Yeah.
Well,
Yes.
well, you win for the dumbest charge you've ever
Yes,
seen.
you definitely win.
Yes. How about last one here? How can you get the most out of your HSA or FSA, depending on what you have? That's one of the things a lot of employers provide that as an option. How can I maximize those dollars that I have available?
As someone who has one for the first time, I'm learning a lot about that in real time. I think, again, just like we said with insurance, being so intimate with your plan and knowing what's covered, I think people are really surprised to know, like, oh, I can actually get my glasses covered and my contacts covered and a cane covered and a toilet seat covered and or toilet chair covered, shower chair covered. So to not let that money sit there and go to waste, but know exactly what you're supposed to use it for. And again, like not to be redundant, but quit being the passenger, be the driver. Don't just try to use it hoping that like, oh yeah, I think they'll cover, this supplement or something. And then you get a bill back from them saying, oh, that wasn't covered and now you owe this money. So like have a clear understanding of what is truly covered. Do you need a prescription for your provider for acid reflux pills, for example, even though they're over the counter? Do you actually need a prescription so that it is covered by your FSA?
Mm-hmm.
So know your plan. That is one of the takeaways today.
And I would say with the HSA too, get your doctor involved in when you're getting something. I do this for my brother. I will have the doctor write a letter like, yes, he needs exercise. A trainer would be great. He should get a trainer 2 days a week. And now I have that paper. So when I go to file it, like it is coming from the doctor, see right here. And I have that for a backup. So I think it's always good to get your care team involved in what can be included in your list.
I love that. Be proactive instead of it getting denied. And then you have to go and fight it and to go through the claim process.
Yeah.
Even though it feels like an extra step, being proactive at getting that in the first place could actually save you so much headache and time later on.
Mm-hmm.
Well done.
Absolutely. Yes.
Bro.
Yes. Well, and I also think, as freelancers and as independents and just as humans in general, we should not be passengers in our healthcare because it is our lives and our bodies. I see people spend so much time taking care of their house or their car or whatever. And it's like they treat their body like a dumpster. Focus your energy on taking care of the one thing that's not replaceable, and that is yourself. And I think that's like the most important thing, especially when you are independent. You really have to turn that up a notch in a big way.
Absolutely. Absolutely. I'm actually 28,000 words into my next book, which is about how to create a custom career with a chronic illness. So I'm going to reach out to you. I would love to pick your brain and get some stories because I do think that it's really challenging, but really necessary because contrary to what some doctors may think, I remember one time when I was getting my myasthenia gravis diagnosis, there was this comment made like, oh, what are you trying to get disability? Like, don't make that as I actually love to be creative and write and to work and to create things. And no, I'm not looking to get out of work. I'm just looking to create a sustainable type of work. And I think that that's where some of us struggle. There's not a lot of resources out there to figure that out.
Yeah.
Wow. Well, that's the next topic that we'll have you back for is the stigma of diagnosis. Like when you get one or you're trying to get one, maybe the societal view on that. Are you being lazy? Or are you just, again,
you don't look sick.
Oh, yeah. You don't look sick or you just need to lose weight or it's just your age or.
Yeah. All those things.
Or you're drug seeking. That's, unfortunately a big one too.
It would be interesting to talk about that, all of these types of things, these stigmas and how people deal with it and cope with it on a personal level, that just the sadness, the struggle, the depression that can come from fighting for yourself and trying to be your own badass. But I love the way that you put it in your book because being a badass turns it around and makes it into a proactive, I'm in control of my healthcare. And I think that's wonderful.
Yeah. I always tell patients, we can't control how a provider shows up for an appointment. You can prepare all day long and they may show up like a jerk and there's nothing that you can do about that, but we can control how we show up, try to put forth the effort so we can at least do our part. And that is badass. Even if the appointment doesn't go well, you don't get everything you want out of it. If you showed up prepared and you fought that anxiety and you tried to advocate for yourself and tried to speak up, that's badass.
Yeah, absolutely. 100%. So before we leave and hop off here, can you tell our audience where they can find you? What's the best way to get in touch with you? Is it website, Instagram?
Yeah, so my website is littleenginepatientadvocacy.com. My book, How to Be a Badass in a Broken Healthcare System, is available on Amazon and Barnes & Noble online. I am active on all of the things: TikTok, Instagram, YouTube, Blue Sky. You can find me under Little Engine Patient.
All right. Well, thank you so much, Kristina. This was an enlightening conversation, and I feel like we could just keep talking and talking and talking and talking all day, but we will definitely have you back because I think there's so many more of these conversations that we can have. So
thank you
very much.
Thank you so much for having me.
We're so excited for you.
Yeah. Thank you so much. I appreciate it.
All right. Bye.
Bye.
And we're back after a couple of days of thinking about our conversation with Kristina. It was pretty dense, honestly. And there were a lot of really good talking points and things that I had never considered when I thought about sort of patient advocacy. And she really changed my perspective in a lot of ways. I was thinking of it mostly from, how do I pay for this? How do I manage insurance? How do I deal with all of the back office sort of parts of being a patient? And she turned it around for me a little bit and talked about advocating for yourself with the doctor in the office, to get the proper diagnosis. And that was really helpful for me.
Yeah, I think I love that this new kind of job has kind of come out as far as advocacy because there's all types of different patients and there's different needs, because that process of managing healthcare, whether it is mental health or like in her case, chronic illness, it is so isolating, and it's also so cumbersome to navigate because there's so much vocabulary and information. And then there's also the intimidation factor of you don't know, but they know, but you need to know, but you don't understand. So I love that it's a field that's growing and that Kristina is the perfect person to be in that and advocating for it. So it was really cool. I'm really glad that she shared that, and excited that her book is going to be out there helping other people.
Yeah. Really excited for the book. So what was your takeaway?
I think it's, because we kind of gone through the process of advocating, and I've seen this with caring for my brother, caring for my parents, and also kind of going through my own stuff too. But I do think it's essential from the very beginning of healthcare to just be aware and be an advocate for yourself from the beginning. And I think that goes with tracking your information, making sure you're asking good questions. I like that she talked a little bit about the patient intimidation of asking questions. I think there's a little bit of us when we go into situations where it's the doctor, and the idea that the doctor is always right and that's the expert and they're obviously heavily educated, but you can ask questions. I think it's smart to go right at that. It's well, it's my body, it's my life, it's my experience. I have a right to ask questions and get clarification. And hopefully you're with a provider that welcomes that kind of stuff. So I thought that was really cool. I also like that she brought up the idea of, and this is the role she played, but having a third party. If it is a patient advocate, that's awesome. Or if it's a person, a friend, a colleague, somebody who can just be there with you, whether it's sitting physically in the appointment and taking notes or helping you to remember to stay on the question list that you have, or just supporting you before or after. Just somebody else kind of double checking things on your behalf.
Yeah, that is a really helpful hint. My wife has done some caretaking in the past, and she's worked with elderly patients, and she's been that third person in the room, just listening and writing notes and translating things down. That way she could pass that information on to other family members too, especially when you're dealing with elder care. There's a lot of people that sort of need to be informed and need that information, want that information. And she was there to write it down and to be that third party listening for things. And I know that the families that she's helped really appreciated that side of it. So definitely having just a listening ear in the room, I think is very helpful. For me, my takeaway was to treat the first appointment as a job interview with the doctor. I really liked that. I'd never thought of it that way before. I'd always taken the passive perspective of, the doctor has all of the knowledge, the history, the experience, the schooling. I should trust whatever they have to say. And if they say that I'm not sick, then I'm not sick. I really like the idea that the first time I go in there, come prepared with some questions, with a goal statement, and treat it like a job interview. I am interviewing you to take care of me or to take care of my loved one. This is as much about your bedside manner and your advocacy for me as it is about your knowledge and experience and how smart you are and the diplomas that you have on the wall.
Yeah, the goal statement thing was really cool. And it's funny because as business owners, we walk into a meeting with the idea of like, what do I hope to get out of this interaction? But I don't walk into doctor's appointment being like, what I hope to get out of this interaction is like information or prescription or direction or referrals, or I never think about it like that. So I did like that idea because it helps you to keep your appointment very focused. Like, am I leaving here with what I had hoped to get when I was entering the office? So I thought that was really cool.
Yeah, I did too. In fact, that is my start. So you stole my start. But it was definitely, we haven't gotten to the starts and stops yet, but I'm going to go ahead and skip ahead. I was going to start to have a goal statement to be prepared for the appointment. I know what information I want to leave there with or what plan I would like to have at the end. You just have to make sure that when you leave that there are takeaways and next steps. Just like when we have a business meeting and, the last thing that any good meeting leader should do is, okay, what are the takeaways? What are the next steps? And we should definitely do that with our healthcare. And I, unfortunately never thought of it like that before.
I think that's really huge. Maybe the framework so that everything should just be a business meeting. Like you're approaching all things. Do we have our notes together? Do we have action items? My start was to be better organized with files and things like that. And I, caretaking for several people, and there's lots of paperwork and there's lots of things that change constantly. And I'm probably okay-ish organized, but to be better organized saves you from future frustrations. So I'm going to start that.
Yeah, absolutely. And I'm going to stop thinking of, healthcare advocacy as just helping with the cost of care and helping with the insurance in the back office. I think that's important. And there are definitely people out there that can do that, to think about finding a person that can help get you, clear off some of that paperwork. It can be a nightmare and a headache. And for me, that's the thing that I always think of when I think about going to the doctor or anything like that is, dealing with insurance, dealing with all the paperwork. And there are people out there for that, but I'm not going to just limit it to that anymore. I'm going to also think of it the other way. If I need a person to advocate for me or help me just to prepare that goal statement or help me to understand what I want to get out of my next treatment or whatever it is, to help me make a plan for my care itself, I think it's really, really helpful.
Yeah, it's funny because it's always, it feels a little bit like, well, I don't need to pay for that because I can do it. But then you realize when you start getting into those situations, how time consuming, how I'm going to say rabbit holing, because I don't know if that's a real phrase, but you spend so much time on hold and sifting through information and trying, that it's super time consuming and it can be really frustrating. And the thing that's critical is a lot of times you have to pay attention to all those details. And when you're frustrated and exhausted and you want it to be done because you have life happening, you don't pay attention to the details, which then causes problems in the future. So it's money well spent to have those kind of people when you really need them, because it will save you money in the long run from mistakes and things. I mean, I have an advocate for my brother who's helping us navigate the process of getting, sign into waivers and long-term care and all of that kind of stuff, because there's people who know that world specifically, just like Kristina, who can do it much more efficiently and tell you like, oh, you don't need to talk to this person, talk to this person. And that is gold when you're going through stuff like that, for sure.
Absolutely. Absolutely. So what are you going to stop?
I'm going to try to stop. Not that I teach my kids to be passive by any means, but I think it's good in light of my kids are entering the teenage years. I'm thinking like, am I giving them the foundation for like financial literacy? Am I giving them the foundation for like how to handle conflict? I think this is the critical one to talk about, because I don't think we ever talked about it as when I was growing up, where it's like paying attention to how you feel. I think mental health is a big thing to talk about. We do talk about this a bit. It's like, how am I feeling? When I ate that, did I not feel well? And if I'm in the doctor's office, like, you don't need to have me answer for you. Like, you are now 12 or 13. Like, you can tell the doctor how you're feeling. So I think the more that we can teach our kids to advocate for themselves at an early age, and not necessarily through mom or dad or through their doctor, that's going to help to like lay that foundation kind of going forward.
That is an excellent point. I think as parents, we want the best for our kids, and sometimes we talk for them too much and they never learn how to do that for themselves. I mean, I'm definitely guilty of it. I think every parent is on some level, whether it's, your healthcare advocacy or talking to the teacher or whatever it is, but giving them the tools and helping them to be able to express, my knee hurts. Okay, what about your knee hurts? Where is it? What kind of pain is it? Let them describe all of those things to the doctor, as opposed to you trying to fill in the blanks. Because you might not have all the information, and they might not have the perfect words to describe it, but let the doctor ask them and let them, go through that process so that they can learn it for themselves. I think the earlier that they can do it, the better.
Yeah. And I think it's so important for our kids to understand that asking questions is not a bad thing. It's because I think a lot of times when we think about authority figures, teachers, doctors, it's like if I'm asking a question, I'm being disrespectful. And that's not true. I always tell both of the kids, you can always ask. They can say no. It's not a bad thing to hear a no or whatever. But I'm like, you ask the question if you have a question and be okay asking questions. And I think that's an important thing to kind of
Yes, absolutely. That's a big takeaway, not just about healthcare advocacy, but just how to advocate for yourself in general. And that applies, I think, to all of us. But it is a great skill to think about nurturing in your children, for sure.
Mm-hmm.
Well, thanks so much, Kristina, for sitting down with us today. Thanks for everything that you do for all of your patients that are out there and for enlightening us on what it's like to be a healthcare advocate and just that new world and that new sort of industry and job. I think it was really, really fascinating and interesting. We will be back in a few weeks with another episode. And until then, I'm John.
And I'm Mari.
And we're reminding you that winners can quit and quitters can win. This podcast is for informational purposes only and does not constitute medical, legal, or financial advice. The views, thoughts, and opinions expressed are the guest's own and do not necessarily represent the views, thoughts, and opinions of Command Q or Uncompany.